So this is an innovative program that's ongoing right now, and we've actually had quite a bit of engagement from the international world where we've learned from other Konate. So the patient 4.3, patient advocates and patient safety champions, this is asking countries to really organize, help organize your patients. Give them the skills to be effective advocates. You know, you can upskill your patients by teaching them how to tell their stories. You can help patients become effective partners by teaching them about patient safety, design thinking, how the government actually works in patient safety. And so capacity building is a really important mechanism to help your patients become more effective partners to work with you. Now, an example of that is Patients for Patient Safety Global, and we've got Patients for Patient Safety Canada, US, Denmark, Ireland, Germany. We've got several Patients for Patient Safety chapters around the world. And you're going to hear from Professor Tan about another structure that engages patients and families within healthcare systems. So that's, think about, especially in healthcare systems at your government level, how do we organize, how do we find these patients, organize them, and then really mobilize them to be partners with us in problem solving around patient safety. So strategy number 4.4 is patient safety incident disclosure to victims. And I want to share that this is probably one of the most challenging of the strategies of this plan. And this is really when there are bad outcomes that the patients and family members, that there's full disclosure. I do want to share there's been some movement. The United Kingdom, it is a statutory requirement. And in one state, Victoria in Australia, it is a statute if that doesn't happen. So we're making progress. We're hoping to learn from each other, from different countries. How can we monitor this more? A lot of countries are saying they're doing it, but how do we monitor this to make sure they're actually doing this? WhatsApp group where mothers coming into the hospital to deliver preterm babies, they're immediately registered on a WhatsApp group. And this WhatsApp group is mothers can speak to mothers while they're in the hospital, but also the nurses and the doctors. When the mothers are discharged, they remain in this WhatsApp group. They teach each other. They talk about breastfeeding. They talk about danger signs in their newborns. They talk about best practices. But the nurses and the doctors are also involved in it. So it's this learning network that's been very effective. And Nigeria shared with me that this has even reduced educating and empowering patients with information. Another example to flip the Patients for Patient Safety in Denmark has created a curriculum for residents on how to best communicate with patients and families, especially when things go wrong, learning how to best communicate when we're talking about patient safety. So those are just some examples of what we're wrap your head and heart around that. And this is from what I have witnessed the past 30 years as a government employee and as an with our panel. And I think it's time, I'm going to turn it over to Dr. Mauro, and he's going to start moderating our panel.
Thank you, Sue, for this wonderful introduction. So let's start. From the government perspective, from the Ministry of Health of Senegal, Dr. Konate, could you tell us your experience how the Ministry of Health is actively engaging patients, family, social, all the family and the civil society organization in order to improve or co-design public policy from healthcare?
Thank you very much. Can you hear us? Yes. Thank you very much. First, I am glad to be here. And I thank the Philippine people. It is for me a pleasure to chair Senegalese experience in patient engagement. I am French speaker, but I will my best to be understandable. In Senegal, health policy is outlined in Senegal Vision 2050 plan, particularly in Axis 2, who define human quality, capital human, and social equity. It is to say that we must give importance to user satisfaction and safety patient in order to establish an efficient health system which is accessible to all. In this health policy, we have an important program called Quality Care Offer. This program is to enhance user satisfaction and safety patient in collaboration with Cyber Society, Association of Patients. Because we think it is important to associate Cyber Society and Patient Associate because they play a crucial role in healthcare and quality care. We must know that since 2004, improving quality care and safety patient is a pride for Minister of Health. That's why we create at the level center a director of quality, safety, and hygiene hospital. And at the operational level, we create IPC committee and quality service to satisfy patients. We develop many strategic plans, IPC, quality, we have guidelines for safety patient, and we develop all these tools in collaboration with the participation of patient association and Cyber Society. Even Cyber Society and patient associate is involved in my country, but their participation is not not yet formalized. It depends on managerial leadership or local initiative. But in Senegal, we already involve associate of patient and Cyber Society. For example, in 29, we organized a regional forum of involved patient and associates in Senegal. And they permit us to create an association and define an asset for safety patient. We work closely with Cyber Society. We have 3 Cyber Society we work very closely. It is COSCAS, we see it in the slide. It is Free Cap Center, and it is NGO Sicodev. For example, NGO Sicodev conduct 2 survive for reception in health facility. And the result of their survival permit to formulate recommendation for the Ministry of Health so that we improve reception in health facilities. We also have what we call in my culture pinch. Pinch, it is a a meeting where patients and health workers and families discuss and find solution when we have problem. Engagement is real, but it is not formalized. And we must do something to formalize. Thank you.
That's bringing me to the next question to Dr. Konate. Could you tell us the next steps that you're going to take as a ministry in order to actively engage patients for patient safety, and the impact that you hope to get with these strategies?
Yes, we have many initiatives and strategies to engage patients in safety, to participate to their care. For example, we are in process to develop a new health code to take into account engagement patient. But the most important initiative we take in Senegal is to involve what we call Bajenu-Gox. Bajenu-Gox, it is national, it is Wolof, it is a national language. Bajen define father aunt. In my culture, father aunt have an important place in the family. Bajen, the sister of your father, is the most important person in the family, because they have a leadership, a crucial leadership, and they what I mean, and they be an advisor. So we say we take women in our country and call them Bajen. So they are going to do the same role of Bajen in our culture. This woman is our choice in the country, in the city. So they are mediators between patients and health workers. And they can can do education for the patient, because they live closer with the patient. They promote health, maternal child, neonatal, and safety. When we have a problem in our health facilities, we call the Bajenu-Gox and told them we must do that with this program. And so they be the interface with patient. What we do also, we celebrate every year the day of World Patient Safety Day. For us, it is a way to raise awareness and educate community, because we have mobilized. Also, we organize exchange session in hospital via open hospital day, in order patient to discuss with health workers, because people, patient, health workers don't have enough time to discuss. When we organize open day in hospital, they can stay and discuss with patient and their family. So, and we also work with civil society if there is a problem in hospital or district. That's initiative we take, and we think it is going to have results, because it is a local initiative, it is a cultural initiative. Family stay closer with health
Thank you, Dr. Konate. Well, previously, Sue taught us the relevance of how important could be to create a network of patients and to engage them in order to improve their participation on public policy, but also in a very practical level during their own healthcare care. So Dr. Tang has a lot of experience. In Singapore, he created the Sing Health Patient Advocacy Network in 2017. Could you tell a little about what is this network consist and how it contributes to patient safety and quality of care?
First, thank you for inviting me. So, you know, in Philippines, place I'm very well treated. Thank you very much to the organizer. Thank you so much. I'm from Sing Health, which is the largest cluster in Singapore, and also from Duke-NUS, which is the medical school formed by the National University of Singapore and Duke University in US. So you got the hybrid of that. So this issue about the, you know, we formed the Sing Health Patient Advocacy Network. Why do we form it? You know, in Singapore, we are, from the point of patient engagement, we are actually quite paternalistic in the way we do it. And I think similar for all the Asian societies. So I think the West has a head start in this, in some of them doing very well. Just heard from Canada, they are doing fantastically well, right? But for Asia, we are in a paternalistic situation. The mindset is very different. Way back in 2017 or so, our staff don't have the concept that patients should be involved in anything, right? Because if they are involving, they are actually disturbing our management, and then if something goes wrong, it will be leaked out to them, and it will get sued and all that. And that is actually the mindset that we are thinking about. In Singapore, we actually try to engage patients a lot, but not in a partnership way. We engage them. We have a lot of patient support groups, right? Whatever disease we have a patient support group, and they did very well. I think this is fantastic. They teach each other how to do, you know, for colostomy, how to do colostomy care. Every time when there's a cancer patient, there's always a corresponding cancer group to support that as well. And in Singapore, we went further ahead. In 2016, we adopted the Swedish model of Esther care. Basically, we thought that social determinants are very important. So besides the healthcare determinants, we have a group of coordinators that manage the community care of the patient to try to coordinate healthcare as well as social care. And because we the care for this group of patients is fantastic. But actually, we are still at that level where the patients are actually passive recipients in care. What we want is to go to be an active recipient, and on top of that, to be a partner in care. And that's why we formed the Sing Health Patient Advocacy Network. And it was to my surprise that it took on so well. Basically because maybe they have also learning, they actually learned from the West as well. So as we were forming the group itself it becomes a sort of semi-autonomous. We give them the freedom to choose their leaders, and then to recruit themselves. We provide the secretariat support. The most important part about this setting up is actually the leadership. Because our Sing Health leadership fully believe that we want to engage patients in the best possible way. And that was because of an incident, of a Hep C incident that happens where there were a lot of morbidity and mortality. We felt that we need to be bringing our patient partnership to a different level. And that's how we start the Sing Health Patient Advocacy Network. And how do we start it? Actually, we ask each of the hospitals which you have, there are about 11 hospitals in our network system. We ask the CEO, CME, okay, we all truly believe that, try to get a couple of patients who have gone beyond their disease, right? They have suffered, they have their life experience for that, but they want to do more. Not only for their disease, but for the hospital, the network, the system that we're doing it. And we gather all of them together. Initially, we were doing a bit of a feedback session. later on we try to involve them in as many communities, as many so-called committees as possible. Firstly, of course, the quality committees, and what they bring is that they bring the patient perspective. So, the things that we do become user-friendly to patients. It's very good for the patient. We even have a plain English speaking, for example, to speak in terms of the medical terminology, right? To ambulate, don't tell me, please ambulate, right? Please walk about. So there are a lot of, we even teach the healthcare staff how to speak so that the patient can understand, and if they can understand, it will be safer care. Because if they don't understand, that is a problem. Then we bring them to the next level, which is to the policy kind of committee, and the hospital design committee, so the emergency care, the acute care, the dental care. As they set up the hospital, we will put in a patient there, to put in the unique patient perspective and insights into that. And that also works very well. But the most important thing of this is that because while we are doing this, there is the mindset of our staff change, right? The patient say, you want to improve me, please engage me early. And every time when there is some community being formed, the first question, can we get a patient advocate in? That's where I think it works, because I recently was trying to, set up the menopause guidelines. So the chair of the menopause guidelines said, can we bring in a patient advocate? I'll be very happy to do so. Just give it to them. So, so the mindset change. So that's why I think it's probably the most important aspect relating to the SPAN setup and stuff. Yeah.
Thank you, Dr. Chan. And how does SPAN align with the strategy regarding empowering patients? Which strategies do you use, and which of these strategies could other hospitals or other institutions implement in order to empower patients?
Yeah, so I was looking at the Global Patient Safety Action Plan. So while we were doing this, I was also involved in the Global Patient Safety Action Plan. So some of the ideas comes from there, and in fact, all the 5 points that was listed by Sue just now, this advocacy now, which is similar to, of course, the American Patient and Family Council, but we brought it to a concept where it's advocacy that is important. So all the 5 points, for example, the most important is the 4.2, right? You need to have advocates and patient safety champions. We have done for the staff, all our staff, we asked them, do you want to be a patient safety champion? So we have a network of staff of patient safety champion. And from the patient, so this is the group that is the advocates for patient safety. And of course, the most important is to co-design, co-develop the programs and the policy. That is relating to 4.1, right? Yeah, 4.1. And also another remarkable thing is that I find that they actually help out a lot with our education. They're involved in all our educations at the various programs that we run, be it a certificate program, a graduate program, a master's program. We bring in our SPAN members, and they are very willing, and they are able to teach. And there are 2 unique programs they especially crafted by them together with us, and which they lead. One is that they train patient advocates to be better communicator. The advocacy communication training. Then another one is that they teach usually the nurses and the allied health how to create a patient-best experience, and they actually run this course as well. So in other words, they're actually part of the trainers within our system. And you'll be surprised, I don't really pay them. It's actually quite sustainable, because in Singapore we realize there's a group of people who have gone through that, and they're willing to help. They're not asking for remuneration and anything. They just want the recognition, and when they help, they feel very satisfied. So to me, there's about almost 100 of them, and they're very happy with that as well. And of course, because of the tempo has changed, we are more open, right? So in fact, if you can see over here, right, together we come up with a mutual care pledge, that we respect and trust each other, we communicate with each other, we safeguard abuse. So we actually come up with a mutual care pledge, which we launched. At the same time, during the COVID period, the staff was very stressed, and they actually, on their own, write to to Straits Times, which is our national media, to say please do not abuse the healthcare staff. Because they saw a lot. Please practice kindness. Please respect them itself. And they actually are our allies, right? They are truly the partner itself. And because of that, in terms of information, 4.4, 4.5, right, relates to the information. They did very well. They provide the workshops. They come to our educational session. They teach, and also that we are more willing to share vision, and so there's the level of transparency is there. So in terms of open disclosure, it becomes easier. So I just to say, I was very surprised by just this simple act of bringing them together, and they just take a life of its own, right? The only thing, of course, we need to do, the main thing is that to be able to give them the support, and the leadership must truly support and believe that. Because if the leadership don't believe that, they will say, okay, this is just for sure. But we really want, and every time when there's a big event, we bring in our SPAN members in, and we recognize them. All fellow colleagues and our SPAN members actually recognize them, and they feel very happy about that. That's all I say.
Thank you. Basically, beautiful experience and showing us that many times you don't need many resources to do big changes and sustain those changes.
In the Swiss cheese, right? I always thought that there's organizational factors, style factors, and the last layer, the last Swiss cheese is actually the patient layer, which we've forgotten, and that layer can be probably the most effective. So we add, instead of 4 layers, add the final layer, and if your system doesn't get the patient who is engaged, will be able to catch that error for you. So that is the last Swiss cheese, the last frontier.
Great, thank you. You're a co-team leader from the Germany Coalition for Patient Safety. So basically your role is to advocate with the Ministry of Health of Germany in order to promote the active engagement of patients in their own patient safety. How does the government, how do you get to work together? How is the relationship? Could you tell us about a little more?
Yeah, of course. First of all, also, thank you very much for letting us speak on this very important topic. I think we always talk about patient-centered healthcare, but often at these events we don't really get to speak a lot from the patient perspective and about the initiatives that we're doing in this regard. One step back, just for understanding, we are an NGO, and we are not attached to the government directly. I know in some countries there are patient safety initiatives that are part of the government, but we are independent and we are a network. So we do represent patients and their families, but we also represent like the whole network of healthcare. So we also talk about a lot of other issues, and you will see that I will also show you some projects that we're doing that are not only addressing patients. So please don't be confused. Okay, so how do we work with the German government? I think also there will be a lot of slides because I'm German and I like to have visual representation. So yeah, bear with me. So the first layer would be just the direct feedback on policies that are being made. So in Germany, there's a system where policies are being drafted, and before they are actually officially discussed, there will be a round of statements that are being collected by different experts on the topic, and our NGO is lucky enough to often be asked for feedback, and also is sometimes invited to the actual hearings before the policies are being made. So this is like the most direct way that we work with the government, and I put some of our statements on the screen. But there are a variety of topics, and we really try to make statements in every context that has to do with patient safety. So that can be financing, that can be a new structure of our healthcare, that can be something just about like making the healthcare system more diverse. So we're really trying to put patient safety in whenever we can. Maybe switch on, yeah. So then we have the academic level. So we are constantly exchanging the newest research on patient safety. The German government is also sending us research they're finding, so it's like a nice two-way street. And we also started to do studies and do research within our NGO. So right now we are doing a project that's called PSI-Bund, so it's called PSI for Patient Safety Indicators. I know we all probably know the OECD indicators that have already been developed. They're the foundation for our research, and we're trying to draft off patient safety indicators that we can apply to all of Germany, because we have a data problem in Germany as of now. And as you will see on most of my slides, our projects are generally funded through the government. I'll talk about this in a second more, but either directly through the Ministry of Health or through other governmental institutions like the Federal Joint Committee. So we're very lucky because as an NGO, obviously we wouldn't have the funds to run big projects like this without their support. So our biggest company this far is an awareness, not this far, but in like the recent year, has been an awareness campaign about sepsis. You can already put it on the next slide because I put a QR code in there. We do actually have materials for this campaign in English for patients and their families. So the campaign is set up in a way where we really try to also reach every part of healthcare. So we do like schoolings to detect sepsis, like teach the people that are actually working in the healthcare system, but we also address stuff to patients and their families directly. And our brochure is actually available in a variety of languages. So maybe your language is also under these. And yeah, we're really just trying to raise awareness. And I think these campaigns are amazing, but it's more of an example for one specific issue you're tackling. So it's easier to monitor, it's easier to draw them up, but it's not addressing the overarching issues. I will talk about a different project that is actually patients for patient safety related in a second. But before, I wanted to show that we also try to work not just on the German level of patient safety, but to also take all of the experiences that we have from this year, 20 years of patient safety organization in Germany, and really bring that into the next levels. And obviously being here is a great way of sharing our experiences, seeing the projects other countries do, but we're also doing that on the European level in the European Patient Safety Foundation, where I'm also a board member. And maybe you know the campaign Fighting Fatigue Together. I've also put a QR code there in case it's interesting of you. It's addressing healthcare workers and how to deal with fatigue. And it's another amazing example for resources that have already been developed in, inaccessible languages that we can all just take and learn from. So, and we also do, obviously, advocacy work on the European level in that instance. And I think there's a lot of movement happening there, but we are still exploring how to actually, implement long-term change on that level, because the collaborations are newer and it's not a direct governmental collaboration that we do.
Thanks. Some speakers before talk about how important it's to build this strong patient involvement in order to give them the leadership in order to get somehow some more an horizontal relationship with the healthcare facilities and also with the government. Do you have any strategies in order to improve this leadership from patients to transfer knowledge to them during this year? Could you share some examples?
Yeah, definitely. I think we can maybe first show our Patients for Patient Safety materials that we've developed. So in general, I think, so strategies, obviously there's an abundance of strategies, and Sue already covered, the resources that we have from the global from GSAPPing. Um, so there are these different areas that you can target also in your work, and strategies that you can develop based on them. So one of them is raising awareness, like within the patients and the families, that they can do something, right? So we prepared, we have so many brochures, so many different materials that really directly address patients and their families. We try to do like a mixture out of developing new materials based on what's currently happening in our healthcare system, as well as like really having expert groups draft up and see what we're still missing. Because if you've been doing this for 20 years, you will have a collection of a lot of materials. So we're really trying to see what do people ask for, what do they use a lot, and develop from there, which I think is quite important. And all of our materials are free, so people can contact us and we send them to different hospitals, to members, to individual doctors, so whoever wants to empower their patients already in the waiting room can access the materials and lay them there. So that's definitely one of the ways. And then we also have been trying to create our own Patients for Patient Safety campaign to really directly address the patients and their families, because I think something we all know it's very important to include patients, but I think patients don't always realize that themselves. And in the different healthcare systems, like in Germany, we have a very strong hierarchy still in our healthcare system, and maybe in general, like if you're a professor, you're more important than a doctor, and so on, going down to nursing and people working in the hospital in general. And I think patients have just not realized yet that they should be included, and they have a right to ask for it. And so we got inspired by the campaign that Susan did in the US, posting a variety of videos from people just telling their stories. And they're sad stories, they're upsetting to hear because it's about people making mistakes, but it's so much more authentic, and it reaches people in a different way when you hear them tell their authentic stories of what happened to them. And at the end of the videos, we always end up with a strong message with, what should have been done differently. So you reach the people directly, right? And nearly all of them said they just wanted to be communicated with better. It's a very simple step. So so we did this to reach people on an emotional level, let them know you can do this. And then this initiative developed further into an initiative called Patients as Experts for Patient Safety. So another thing from the G7 is that you want to create an advocacy for patients, and it shouldn't just be us advocating for them, but it should be themselves. So we did a workshop and did a media training with them. So we have a speaker pool now that we can send also to medical congresses, that we can send to events to just speak for themselves and advocate for themselves. And in the context of this media training, we also developed a specific flyer that is really made from patients for patients about how to speak up, what they should be mindful of. And a flyer is such a nice way of addressing it because it doesn't cost a lot to print it. You can really put it in theory into every practitioner's office, and just having them see and understand that there is a chance for them to speak up is super, I think, crucial in this step of reaching them. But yeah, we're trying every year to come up with new strategies. We're constantly trying to find new ways to empower the patients, also empower the healthcare workers to empower their patients, right? Because it's in the end a system that we're trying to better, and we're trying to, revolutionize maybe, right? To see patients as partners and, as an active participant in their patient journey.
Thanks a lot. Now, Dr. Jittima, your experience is on at facility level, let's say. The patient experience plays a crucial role overall the quality of every healthcare system and response. Could you tell us what mechanisms or system has been established in your hospitals in order to assess this patient experience and to improve it? And how do you use the information that you get from these strategies? Could you?
Thank you. I am a gynecologist whose heart is close to patient experience and second victim support. Thank you, the organizing committee, for inviting me to this event. My first slide, please. Thank you. Patient experience listening system has been implemented at both hospital and unit or point of care level in my hospital since the year 2018 or 19. We have trained hospital staff and provided a variety of methods to capture patient feedback and their actual experience, including survey, patient journey mapping, patient shadowing, focus group, and complaint analysis. Not only that, we also include patient care experience observation activity, which is the fly on the wall, to observe interaction between providers and patients, and also the environment of care. Then the patient experience, we can capture both functional and relational aspects of patient experience, and the issues can be identified. Then the patient experience subcommittee takes responsibility for analyzing, prioritizing, and reporting quality and safety issues based on patient feedback. The Hospital and Healthcare Cluster Executive Board plays a pivotal role in influencing, facilitating, supporting, and monitoring the delivery of care with safety and quality. I'd like to give you some example of the improvement from patient feedback. The first one is the Rama application. It's an application on mobile devices. It has been developed for quality improvement in terms of accessibility, efficiency, and convenience. The newer version has added a special feature of drug allergy report. Patients can check and update their data regarding the drug allergy, and they can also access their laboratory results as well. Our hospital is a public hospital, university hospital, so that initiative, I think it's striking, in my opinion, yes. And we also add more friendly and safer environment based on the information from survey, complaint, and patient care experience observation. And not only reporting to the executive board, the patient experience subcommittee also communicates with and encourages with both clinical and non-clinical staff via a patient experience website for better understanding of the importance of quality improvement and safety. The example of information that we communicate, the first one is about the patient voice. It is reported in infographic format. Patient stories and compliments are reported. And the second one is that the patient satisfaction, complaints, and safety issues are transformed into insightful visualization. Our hospital leverages business intelligence to analyze collected data and present it in a clear, interactive dashboards. It's a real-time monitoring for our CEOs. That is the hospital level. I'd like to add some information at the point of care level. The clinical lead team and multidisciplinary care team drive quality improvement and patient safety initiatives according to patient experience information based on the patient journey mapping and in-depth interview. units developed the post-operative telephone home health care. And also in my department, the labor room hotline 24/7 has been initiated. I think it's useful to detect for early detection of complications or adverse event. And also in my special clinic, I am a urogynecologist, pelvic floor clinic. We provide essential information about diagnosis and choices of treatment for patients and their family members in the printed and also digital forms. Our team members are willing to spend time to listen and respond to patients' questions and concerns. We assess, advise, and assist them in shared decision-making for appropriate and people-centered care. Thank you.
Dr. Jittima, during the morning we heard a lot about the justice culture, really, and you need transparency and trust, basically. Could you tell us a little about how do you foster a culture of openness and transparency in your hospital when basically it comes to disclosure to patients to give them the bad news, basically, and according to this justice culture, could you tell us your experience?
Thank you for this issue. In order to foster the no-blame culture in our hospital, we have my second slide. Thank you. The mechanisms of reporting, learning, and supporting is used in response to the incident report. Ramathibodi Hospital complies with the national policy of 2P safety, patient and personnel safety. Firstly, incident and occurrence reporting have been consistently practiced in our hospital. The hospital staff acknowledge its purpose as a tool to improve patient safety and care quality now. Secondly, risk management and clinical lead teams take a lead in conducting a root cause analysis for severe adverse event. Our hospital followed the root cause analysis using the RCA square, root cause analysis and action format, to discover appropriate risk reduction strategies on the system level problems. Patient engagement plays an important role in the step of data gathering by giving relevant information and feedback about the problem. I'd like to give you one example of the initiative from medication errors. The system of CPOE or computerized provider order entry is introduced, and we have 100% compliance from our doctors. And thirdly, there are supporting procedures for patients, family members, and also our hospital staff. After a serious incident, honest and direct communication is essential, as we mentioned. The clinical lead team is in charge of disclosing an error and providing necessary support, compensation to patients and family members. The second victim support system is established in our hospital to help our hospital staff at the time when they are most vulnerable and need support. It's called Support System for Our Staff, or SSOS. Thank you.
Thank you. Thank you. And now, maybe one of the most relevant perspectives, the one from the patients, of course. Miss Girlie, you are the vice president of the on the foundation of Philippine Alliance of Patient Organization, PAPO. Yeah. What strategies has the PAPO used to empower patients to speak up about safety concerns? And how has the organization contributed to create a culture in the healthcare system where patients feel comfortable speaking without fear or retaliation or judgment?
Okay, good afternoon, everyone. So thank you for the opportunity to share what PAPO has been doing for patients and patient safety. So a little background about PAPO. We were organized in 2011. This started with 5 disease-specific patient groups, and one of my original patient group, which is Kythe, we take care of children with cancer, was one of the original, the founders of PAPO. So we got together, the 5 of us, the patient groups, and we saw that we had cross-cutting issues. And one of that was how to navigate the PhilHealth, the Philippine Health Insurance benefits and process. So we banded together and we decided to educate our patients, our members, on how to navigate PhilHealth. And then, we became members of the International Alliance of Patient Organizations, AYAPO, and also of the Union of International Cancer Control. So we are aligned with international patient groups. And then as we were talking with health leaders and among health patients, we said, how can we have meaningful engagement with health policymakers? Because like what has been said, it's paternalistic, right? It's still doctor-centric. So they put the patients aside. They don't listen to patients. So we realized that we needed to capacitate patients and patient leaders, especially increasing health literacy and communication skills, like what others have been doing. So what we did was we provided our patient leaders with numerous workshops, starting with understanding the Philippine healthcare system, universal healthcare, health technology assessment, fundraising, IT in health, etc. And in 2023, we also provided our patient leaders in cooperation, in partnership with the Asian Institute of Management, a postgraduate course. So I am a graduate of that, of healthcare leadership and management. So equipped with the proper knowledge, skills, and attitude, we are now more confident in sitting at tables, at policy-making forum or bodies. So one such policy-making body was with the Department of Health. We are now members of the technical working group of the patient safety program of the Department of Health. And actually the framework of culture of safety, we contributed to that. And in the AO, Administrative Order 2020-007, which is our national policy on patient safety in health facilities, there's a provision there which says that health facilities shall be composed of multidisciplinary members with representatives from administrative and medical staff and patient partners from patient groups. So, as usual, it's always the implementation that's the problem, but at least it's there, and we can continue to advocate for it. Now, in 2020, PAPO participated in a research. So we partnered with an academe, with the University of the Philippines, entitled Assessment of Performance Measures and Indicators of Patient Safety in Select Government and Private Hospitals in the Philippines. And in developing the patient safety indicators baseline, which the Department of Health today has included in their hospital profile reporting platform. And under the effective communication indicator, PAPO suggested including patient participation and patient's caregiver involvement in inter-unit or inter-ward handover. Now, PAPO also participates in a lot of World Patient Safety Conferences and summits, and we consistently advocate patient and family advisory councils in hospitals. And we are also members of consensus panels in the creation of clinical practice guidelines. So I was just telling Dr. Anna. And I am a permanent member of the Department of Health Single Joint Research Ethics Board and the University of the Philippines Research Ethics Committee our PAPO patient members. Being a member of the ethics boards help us or enables us to safeguard the patient's safety, especially when it comes to vaccine trial recruitments. Why do I say this? Because during one of our FGDs, we found out that during the vaccine trials for the pandemic, some of the companies, the sponsors, would recruit patients or participants for not just one clinical trial, but they were being recruited for different clinical trials. They were taking advantage of the patients, the participants' vulnerability because they needed money during the pandemic. So we had to put a stop to that. We together with the UPNIH, we reported that to the FDA, and now there are stricter rules on recruitment for vaccine trials.
Have you seen an effect, especially in improving the communication between the healthcare providers and the patient in let's say, in facility, in home care facilities? Yes.
For the community, what we did was we partnered with the Philippine Pharmacists Association, and they helped us in medication counseling. You know, it was funny because during that one session, our patients brought their medicines, their array, their menu of medicine. They laid it out, and then the pharmacists were saying, what's the problem? You know, I've been having this headache, and I'm wondering.
And willing to answer the questions. All right, so it has been a very, very rich discussion of all the best practices and strategies shared by our panelists. And we don't want to keep you waiting. All right, so just perhaps give me 2 minutes just to wrap everything. And I've been hearing big words: co-design, engagement, empowerment, partnership, patient and family at the center of all this. All right, so let me call to the stage our USEC to hand in the certificates. USEC Maria Carolina Taino, Undersecretary of Health, Supply Chain Management Center, to hand in the certificates for our esteemed panelists. All right, so let me just read the citation for all our panelists. This certificate of appreciation is given to our panelist that has been recognized for his or her valuable contribution and participation in the 7th Global Ministerial Summit on Patient Safety, held on April 3 to 4, 2025 at the Asian Development Bank Headquarters, Mandaluyong, Metro Manila, Philippines. Given this 4th day of April 2025 in Mandaluyong, Philippines, signed by our Secretary of Health, Dr. Chidoro Herbosa. This is for Dr. Mauro Brignole. This is for Ms. Susan Sheridan. This is for Dr. Ndella Konate. This is for Dr. Tan Kok Hian. For Ms. Kira Tosberg. For Dr. Jittima Bartlett. And for Ms. Miss Maria Fatima Lorenzo. Okay, so a photo opportunity for all our panelists and our session chairs, please, at the center.